Brain aneurysms affect 1 in every 50 Americans and can lead to serious medical emergencies, including stroke, brain damage, and death. Current treatments are limited and have flaws. However, researchers around the world are using 3D printing to increase the odds of successful operations and possibly create more effective treatments. So let's take a look at how 3D printing is saving lives and advancing neuroscience technologies. A brain aneurysm occurs when the wall of a blood vessel in your brain becomes weak and bulges, causing the area to balloon out like a pimple. There are currently 2 treatments available to prevent the aneurysm from rupturing. For larger, more complex cases, a high-risk treatment is used to implant a surgical clip at the base of the aneurysm in hopes of cutting off blood flow and preventing the aneurysm from growing. The new gold standard is to use a catheter traveling through the blood vessel and pack the aneurysm with a soft coil, blocking it off from additional blood flow. The problem is, even with coiling, due to the complexity of the shape, size, and geometry of the aneurysm, there is a heightened risk of reoccurrence. Since 2015, there have been a number of surgical teams using 3D printing to increase the success of surgeries requiring the high-risk clipping technique. Scans of the patient's brain are turned into a 3D model, and with the help of 3D printing specialists, a replica is built of the polymer that mimics a human tissue, allowing surgeons to plan their approach and practice the operation. What surgeons are discovering is that by performing the mock procedure, the original plan would not work because of the patient's unique anatomy, and they have to change some of the tools and techniques they can use. Additionally, the 3D model allows surgeons to practice the procedure, which will both improve accuracy and the speed of the operation. 3D printing models also allow surgeons to rehearse the surgery with residents, students, and other colleagues. Come the day of the surgery, everyone knows what to expect and prepare for. Having a 3D printed model of the actual cases becomes invaluable for training medical students and residents or young neurosurgeons. In 2020, researchers at Duke University and Texas A&M expanded on this practice by becoming the first to produce a living bioprinted aneurysm outside of the human body, perform a medical procedure on it, and observe how it responds and heals as it would in an actual human brain. The team was able to replicate an aneurysm in vitro by 3D printing blood vessels with human cerebral cells. A surgeon then performed a repair procedure on the printed aneurysm. After the treatment, the researchers introduced blood plasma into the aneurysm and observed the success of the repair. Additionally, the researchers were also able to observe the post-op healing process. Recently, a team from the University of Oklahoma has been funded for a 5-year research project with the intention of designing a device that can be customized to better treat brain aneurysms. They plan to use advanced biomedical 3D printing to design and create unique devices that can be tailored to the specific geometrical shape, size, and location of a specific aneurysm. Since the project is still in its early stages, there is currently no information on which 3D printing processes will be used, or even what the devices will look like. One of the key benefits of using additive manufacturing in medicine is the ability to completely adapt each device to a patient's needs. Through all this research, 3D printing has shown how it can be used to accelerate the time it takes for new surgical techniques and technologies to leap from the laboratory to the operating room floor. And since no one person is the same, scanning and printing allows customizing medical treatments to improve outcomes. Thanks for watching.